Good evening, and thank you for joining us for this virtual community town hall addressing COVID-19 in the Fredericksburg region. Throughout the pandemic, Mary Washington healthcare leadership has been committed to keeping our community informed, and we know the COVID-19 pandemic continues to raise many questions. Tonight, we are here to share what we know about COVID-19 in our region and what we can do to keep everyone safe and healthy. During this town hall, you will hear from our expert panelists, and we welcome you to ask questions in the chat during the conversation. So let's meet our panelists. First, we have Dr. Mike McDermott, Chief Executive Officer. Second, we have Dr. Sheena Taylor, Chief Hospitalist. Our third panelist is Dr. Christopher Newman, our Chief Medical Officer and Chief Operating Officer. And our final panelist is Eileen Doman, Chief Nursing Officer. So I'd like Dr. McDermott to kick it off tonight to start the program around the latest data in our Fredericksburg region.
Thank you, Lisa, and thanks to everybody in our community for taking a few minutes to tune into our town hall tonight. As everybody knows, we've been doing these to be transparent with our community about what we're seeing. I'm sure many of you, when you look on Facebook and you see that, oh, Mary Washington's having another town hall, it's kind of a harbinger of bad news at times because it means something's happening in our community where we feel the need to get the word out to our community about what's occurring to make everybody aware of it. And so I'll start with our current COVID-19 experience at Mary Washington Healthcare. Between Mary Washington Hospital and Stafford Hospital, we're currently caring for 64 patients who need to be hospitalized to help them battle COVID-19. And so sometimes I've heard people get confused about what this number means. It's just a number of people in the hospital who have a positive test. That is not true. These 64 individuals need treatment only for their COVID-19. We have some more patients in the hospital that might be treated for something else that have just COVID as a byproduct or by happenstance. They're not included in this number. These are 64 individuals that are hospitalized because they need treatment for COVID-19 at Mary Washington Hospital or Stafford Hospital. The graph that's there, remember, we've been showing that all through the pandemic. And this is our experience through the pandemic. The yellow line is the number of hospitalized patients we've had on any given day. And you can see our peak was in January of 2021 when we were up at about 100 inpatients. But just a few months ago, right near the end of June, the beginning of July, there was a period of 6 hours where we actually had no inpatients hospitalized for COVID-19. And we thought we were kind of through the woods, but you can see what's happened from the 4th of July till now with the number of patients and the steep upslope that we are seeing. And most of that being attributed to this new Delta variant that is around in our communities. It's much more transmissible and it is leading to this higher inpatient count. Remember, superimposed on that yellow line is an orange line. That's the number of hospitalized patients in the state of Virginia. And you can see our experience has pretty much mirrored the state experience throughout the entire COVID pandemic. One thing that is a little more different now is where those hospitalizations are. Everything before July, pretty much the leading hospitals in Virginia were the hospitals in the big population centers. Northern Virginia, Inova Fairfax Hospital, Virginia Hospital Center up in Northern Virginia. They always led the way with the hospitalizations. But what's curious today, and in this experience from July until now, is that they're not even in the top 10 hospitals of hospitalized patients. And the hospitals that are bearing most of the burden are in the more rural areas, Roanoke, Lynchburg, Fishersville. Those communities have higher hospitalization. Those are the communities with the lowest vaccination rates in the state as well. I want to bring up a new graphic that we're showing and we're sharing. We put this as kind of a teaser to this Facebook town hall tonight. And this is a kind of a graphical depiction of our current COVID-19 hospitalizations. And remember, these current 64 inpatients, every one of these patients is in the hospital because they need inpatient treatment to help them battle the COVID-19 that they currently have. And so of those 64 inpatients, 60 of those are not vaccinated. 4 of them have been vaccinated. Of our 7 patients currently in the intensive care unit, 6 of those have not been vaccinated. And all of our patients who are currently on ventilators have not been vaccinated. There's a further breakdown by age groups there, but the message is same. And I think this picture is worth 1,000 words, is you can see that this hospitalization trend we're currently seeing with COVID-19 is largely among unvaccinated individuals. It's one of the reasons why we wanted to talk to our community again tonight, talk about the importance of vaccination, and why, if you have not yet been vaccinated yourself, please go get vaccinated to protect yourself, your family, your loved ones, and our civilization. It's a duty kind of for all of us in civilization to be vaccinated. It's like, this is one of the things I talk about. It's we all want to enjoy the benefits of the civilization that we're lucky enough to live in, right? The grocery stores we get to go into, the malls to go shopping, the sporting events, the concerts, all of these things we like to do as part of our civilized society that we all participate in. Well, when we have infectious diseases around that can impact public health and safety, vaccination is a routine requirement to be able to participate in a civilized society. And we have a vaccination now to help us prevent the spread of this deadly virus, the coronavirus. And it's why I encourage everybody, please, it's part of a public health requirement that we all have to participate in civilization with one another. Please get a vaccine, not just to protect yourself, but to lower the overall incidence of coronavirus in our communities to protect everyone. And so that's my plea for everybody here tonight. Please get vaccinated as quickly as possible. When we have this many inpatients in our hospital, it starts to impact the care that we can provide to everybody who needs care for other medical conditions, the strokes, the heart attacks, the untoward things that happen to folks every single day where they need medical care. And when we have this high coronavirus burden and COVID burden in our hospitals, it adds additional layers of friction, visitation requirements, and other tactics we need to put in place in the hospital to make our facilities safer. And we could avoid all of that if everybody was vaccinated, right? And we could provide better care to everybody who needs it when they need it.
Thank you, Dr. McDermott. That's a great snapshot of what's happening, and that infographic is pretty telling. We've been getting a lot of chatter about that online since posting it yesterday. And can you talk a little bit about the differences between vaccinated and unvaccinated patients? Are we seeing a difference in the level of care they need, or is there other things we need to know about that data?
Yeah, I can definitely speak to that. Being a hospitalist, we are the ones that are caring for these patients when they're coming to the hospital. And unfortunately, what you do see is that those patients that are unvaccinated definitely tend to have a higher severity of illness. To Mike's point, those are the patients that are on the vents. And so by just looking at the data and what was presented in that depiction there, you can see that the overwhelming majority of the patients that are really getting sick and really ill and overwhelming the system are those that are unvaccinated. And I know that we're probably going to come to the point where we're going to say, well, what about those patients that are vaccinated? And what's the benefit there? And the reality is that there's a tremendous benefit. We're not seeing as high of acuity of illness. We're not seeing those patients that are vaccinated getting as sick as often. What you are seeing is that when they are getting sick, they tend to have some other underlying illnesses that put them at increased risk. So yes, there is still a chance that a vaccinated individual can get sick. However, the chances of them being hospitalized and dying are much lower.
I think also, Dr. Taylor, we've also seen the patients are trending much younger than we saw previously in the pandemic. A few weeks ago, our largest age group were those in their 30s, 30 years of age. And as of today, you see half of our patients are under the age of 65, and many of those are much younger than that. So, vaccination rates are much higher regionally and across the nation in those over the age of 65. But the Delta variant is really raging through unvaccinated communities and affecting much younger individuals than previous strains.
Thank you. And Dr. McDermott, you did mention this briefly, but let's address it again. We've been seeing a lot of comments and misinformation on the patients that are being treated in our hospital. The 64 patients that were on that slide, they are being treated for COVID, not something else, correct?
Yeah, that is correct. We have I don't have the exact number in front of me, but we tracked that as well. There are more patients in our hospital who are positive for COVID. A few of them are not being treated for COVID. They're in the hospital for other reasons, right? Those 64 are patients who their diagnosis of what they are being treated for is COVID-19 in the hospital, right? So they are all sick and hospitalized because they need hospital level care to help them battle the coronavirus in their body. That is correct.
Thank you. And, you know, we're also hearing a lot of people say, you know, I appreciate the vaccine, and for those that need it, great. But I had COVID March of last year. I don't think I need to be vaccinated. I have antibodies against COVID-19. Can we talk a little bit about how that works and whether people should still get vaccinated if they've had it before?
Yeah, most definitely.
Yeah, go ahead, Dr. Taylor. Yeah.
Sorry.
Yeah.
So they should most definitely get vaccinated. One of the reasons that we talk about is we are looking at these vaccines. They've been studied over and over again, and we know that there's differences in dosing. There's some vaccines that are requiring 2 doses. There are some that are requiring 1 dose. And the efficacy in between those vaccines, in between all of those vaccines, can be different. So taking a chance that I've gotten COVID once, and so that should mean that I'm completely protected is inaccurate.
There's a lot of variability in immune response from individuals that have gotten COVID too, and that's been tested, and how quickly those antibodies wane over time and decrease over time. So although there is that concept of having some natural immunity for a period of time if you've had COVID is not invalid. I'm not saying that's not valid. Certainly the recommendation that has been studied is that even those individuals who have had COVID should get vaccinated to maximize their protection from getting COVID again. And there have been patients who have had COVID multiple times. And so it's not like you've had it once, you're protected from ever getting it again. That is certainly not the case. There have been patients who have had multiple COVID infections, and that's why it is recommended that anybody who has had COVID in the past also get vaccinated.
And some critics of the vaccine have claimed that the vaccine was rushed when we were at emergency use authorization. And now Pfizer was approved recently, but was not able to get that approval last December. Can we talk about what changed to get that approval, and were the vaccines actually rushed?
The vaccines weren't rushed. The mRNA technology on the Pfizer Moderna vaccine has actually been developed over 10 years. So this is a long time in the making. It wasn't specifically for this particular COVID, but it was after the initial SARS outbreak that we saw many years ago. And these vaccines have been around for a while and in development, and they have not been rushed. The emergency use authorization was a way to cut away some of the bureaucracy and get these vaccines to the public quickly, because we were in an urgent pandemic. People were dying every day. When the vaccines came out, the death rate in the United States was 3,000 people a day. That's a 9/11 every single day from COVID. So they removed some of the bureaucracy, but as far as safety goes, they're following their normal process. We just got FDA approval from Pfizer. We expect the Moderna FDA approval really coming very quickly, followed by the Johnson & Johnson. These vaccines have been given to over 5 billion people worldwide. There is nothing that I'm aware of in healthcare that we've studied so closely, given so many people, and seen such safety and efficacy at the same time. So they're highly safe, highly efficacious vaccines. I've taken them, we've all taken them, given them family members, friends. I can recommend them without reservation.
There's a funny thing, there's a funny irony I want to talk a little bit about, and that is there's some people out there who might be listening to us who are like, I don't trust them when they're talking about the vaccine. It's like, for some reason, there's this distrust. It's like, well, we're medical professionals, right? And just about all medical professionals are recommending these vaccines to protect you and keep you safer, right? A public health recommendation. And then those same individuals, if they get COVID and sick, they come into the hospital to us for care. It's like, well, why do you trust us then to provide care to you? It's like, it's a little ironic that you would turn to us when you're sick to come for care. Why would you come to the hospital if you don't trust us now, right? Please trust us. Any medical professional who spent their career in medicine, and let's talk about experts and deference to expertise, right? You can only be expert in very few things. And I wouldn't even call myself, I wouldn't claim to call myself an epidemiologist, okay? But I do have some expertise in medicine. And And so that deference to expertise, trust us now when we say the absolute best health decision that you can have and make today is to get vaccinated against the coronavirus with one of these safe and efficacious vaccines, right? It is absolutely the best health decision you can make for yourself. Trust us now, not when you get sick and need to come into the hospital for care when it's already a little too late.
Yeah. I think it's really important that we talk about where our goalpost is. I think we've definitely moved. At one point in the beginning of the pandemic, we were all looking for something as our community and our loved ones, and we were all watching as people were just dying and dying and dying, and we were looking for something to say, please help us to stop dying, just as a society. And somehow we've gotten from help us so that we're not dying to help us, and we found something, help us so that we're not being hospitalized. And now somewhere we're all the way towards the end and now saying, I don't even ever want to get sick. So if it's not going to prevent me from completely not getting sick, I don't want to take it. I just want us to remember as a community how far we've come in that short time frame, and how grateful we should be that we have this opportunity to say, you don't have to die anymore. We don't have to do this. So just want to be mindful about what our goal is as a society. Is it to stop dying, or I don't want to have the sniffles?
Nearly 2,000 people a day are dying as of this point from the Delta variant that is, ravaging this country right now. That is a lot of people every day dying in this country, and it 100% are preventable.
Let's talk about the impact, like how many people have died of COVID-19 since the pandemic started in the United States, right? And if you added up all of the combat deaths in every US war ever fought, the Revolutionary War, World War I, World War II, Vietnam, Afghanistan, put every war the US has ever fought, that in the Civil War, add up all the combat deaths, right? And all those wars together, we have just about reached that same number with the coronavirus in the last year and a half. I mean, it's absolutely incredible, the devastation that this virus has caused in our country. And we have a way of preventing it now, that devastation. And so it's why I just, a lot of people are talking now about, we just got to do what's right. Everybody has to do what's right. Put aside the politics and the other thinking, right? We have to do what's right, right? It's a responsibility we all have, not just to ourselves, but to one another, right? To our civilization and society. It's a responsibility we all have.
And we're seeing some people have continued fears. They're fearful of the unknown, but they're also fearful of reconciling information that they're receiving. And one of those sources of information is what's called the VAERS system, or the VAERS system, which is a publicly reportable side effects and adverse effects from vaccination. Can we talk a little bit about this reporting system, how it works, and is this reliable data?
Yeah, the VAERS system is like a bulletin board, right? People can post anything on there, and it's meant to just be a way for people to publicly report that they've seen something. And then what subsequently happens is that teams of folks, epidemiologists and other folks, take the information from the VAERS system and put it under scrutiny, right? And see if any of that stuff is real. Are there really trends? Are there things that are happening? Or are there not? Good things can come out of that study. But if I was to put on VAERS tomorrow, like I got vaccinated and I turned into a unicorn, I think it would show up on the system. That's the way the system's designed. It doesn't filter anything. It's just a posting site. So people quoting VAERS and saying like, this is what's happening, it's not true, right? That's not how VAERS was designed. It was designed as a way to just make sure everything reported is shown to everybody, but then it needs to be undergo scrutiny, right? And that's what how people are misrepresenting that VAERS site. Unfortunately, it serves a role. It really does serve a role. It's just being misinterpreted. And so it gets to the whole idea of trusted information, right? And unfortunately, in this era of social media and people posting and pretending to be experts and all this other stuff that's out there, it's hard to wade through what's trusted and what's not. But I would just encourage everybody, put a lot of scrutiny on the information that you're getting and really question, is it accurate and is it not? Is it coming from a trusted source? There's a lot of great information on the CDC website, right? Anything you would want to know about these vaccines, about the virus, they're being extraordinarily transparent on that website. And information does change as we learn more, right? We might say something today, but learn more in the future. This is the way human knowledge works. That changes a previous recommendation. It doesn't mean it was wrong at the time. It means we know more today, and science has showed us there's a better way to move forward, right? Nobody was wrong. It's just we know more today. And so there's a lot of misinformation out there, and unfortunately, people are making poor decisions based on that misinformation. And I just encourage everybody, please be skeptical of information out there. Make sure it's coming from a trusted site.
Thank you. I'd like to move into some of our community questions. The first one we're getting here is about boosters. We expected to hear about this. What is the current CDC guidelines? People are asking, if I'm 65 and over, should I get it? Or if I'm immune compromised at 8 months, 5 months, there's a lot of speculation happening right now about boosters. What do we know right now about boosters or a third shot for the COVID-19 vaccine?
Well, third dose is being recommended, or third shot currently is being recommended for those who are immunocompromised. And you can receive those, under consultation with your physician if you're having one of those immunocompromised states. Cancer, there's many people with autoimmune issues who are on immunosuppressant drugs, people with end-stage renal disease. Those are some of the individuals. Now, they're deliberating at this point and looking at the data to see whether boosters will be recommended for all, whether that's 6 months, 8 months. It's hard to know what the data will support. We are expecting an announcement from FDA, CDC, ACIP, in the next few weeks that will make that recommendation, and we will be following those recommendations and following that data. At present, there is not a recommendation for a third shot or a booster, and we'll wait the next few weeks. We should know more.
Unless they're immunocompromised.
Unless you're immunocompromised, that is approved at this point. Yeah.
There's some talk out there about, we had a fantastic vaccine clinic that we ran at the Fick Center, and if the boosters come, we'll be doing it again. And I think the question is most likely not. We won't be doing that at the Fick Center. These vaccines now are more widely distributed and available. At the point in time we were running that Fick Center, there was very limited distribution of vaccines for communities. We were serving a role in our community to get those out as the supply came in, to make sure we were administering them as fast as possible. But now the vaccines are widely available in many distribution points. And so I don't think the applicability of the Fick Center is likely to happen again, but I don't expect there to be a shortage of vaccine. I think there's plenty of availability of vaccine for the boosters, should they be recommended. Remember, we're all awaiting that CDC advisory panel to issue their recommendation as to whether or not boosters are needed and for who.
Thank you. There are some questions about COVID testing, where people are directed to get COVID testing. This is an issue we talk about regularly here in our organization. And the question was whether we should be testing people inside the ER or outside.
Yeah, don't come to the ER for a COVID test if you're sick and to just want to know if you have COVID. Like, don't come to our emergency room, please. I would ask you not to do that. Find another location to get tested to find out if you have COVID-19. Only come to the emergency room if you're sick enough to level a warrant of care that you need to come into the emergency room. That's what I would tell people. And so there is testing available in our community. I know with this Delta surge, we have heard about some challenges to testing, and we here at Mary Washington Healthcare, we're currently working on plans of how we can make some testing more available to our community at this point in time, because there is a higher prevalence right now than there was even just 6 weeks ago. And so we're trying to have a community response to that. But don't just come to the ER because you maybe have a cough and want to know if you have COVID. I would just ask most of the public not to do that. Come to the ER if you think you have an emergent life-threatening condition or something that needs immediate treatment. That's when you should come to the ER.
Definitely want to second that. We are really trying to get to those patients that are really sick at this point in time. And so it becomes really difficult to be able to focus on those patients that are ill when there are patients that could be managed at some of the urgent cares or in your primary care provider's office. There definitely, I would say, to reach out to those resources, reach out to your primary care provider if you're concerned, if you have a question. We even have our hotline within the organization as well. If you're having concerns and questions, you can utilize that hotline, and we'll give those nurses on the line will give you some direction as to where you could go.
Yeah, we're seeing record high volumes at our emergency rooms and urgent cares at this time, and we need to be available for people who are ill, who need our assistance and care.
Thank you. And if we could show that graphic of our hotline that Dr. Taylor was referencing, that's our HealthLink nurse triage line. Those nurses are available every day from 6 a.m. to midnight, and you can call that advanced line by calling 741-1000 if you are having symptoms or you just don't know what level of care you need. If you need a test, where should I go? Or I'm having symptoms, should I be at the ER? Should I go to urgent care or make an appointment with my doctor? They're there to help you. We are getting a lot of booster questions, so I think we've covered that. So I'd like to skip down to some questions about hospitalizations, if you don't mind going back to that. We're getting some questions about pediatrics. We had talked about 50% of our patients are under 30. Are we seeing pediatric patients needing hospitalization, and what percentage might that be in our hospitals?
Yeah, we're seeing some children that are being hospitalized for COVID. When children get very sick and need advanced care, we partner with some of our academic pediatric hospitals. So we have transferred patients to VCU, UVA Children's Hospital, and others that we work with. I will say pediatric hospitalizations for COVID are at record levels. They're record highs at this point. 750,000 children have tested positive for COVID in the last month. That is also a record high. The Delta variant does not appear to be causing more severe illness in children, but the earlier strains were not as transmissible in children. They didn't catch it as well. They didn't transmit it as much, but Delta is, much more transmissible amongst children. And when you're looking at a hospitalization rate of anywhere from 0.9% up to roughly 2% of children with COVID get sick enough to need medical care and hospitalization, that adds up to a lot of people when you add 750,000 children come down with COVID in the last month alone. So it is a concern. I know our pediatric colleagues are very concerned about the pressure it's putting on children's hospitals across the country, pediatric ICU beds. But again, we generally don't have that level of care here for pediatrics at Mary Washington, but we are in conversation with local children's hospitals.
And thank you for that. And the pregnancy and vaccination and pregnancy and booster, if a woman is of childbearing age and received both shots and then became pregnant, should they get the booster? And what about pregnant women in general?
Yeah, I can talk about pregnant women in general. I think one of the tragedies of the misinformation surrounding COVID and the vaccine, one of the biggest tragedies is around pregnant women and the myth that the COVID vaccine causes miscarriage. In fact, pregnant women are one of the highest risk groups if you get COVID of having very serious illness. A study came out today that I read that 10 times an unvaccinated woman has 10 times the mortality rate of a woman who's not pregnant, and 6 times the rate of requiring ICU care. Earlier in the month, the University of Alabama at Birmingham had 39 hospitalized pregnant women at one time, 10 in the ICU and 8 on ventilators, and had 1 recent death. That's astounding to me at one hospital to have that many pregnant women hospitalized. We've seen this here at Mary Washington over and over with pregnant women coming in needing ICU level care. That puts their babies at risk. There is nothing you can do that's more important if you're pregnant for your child, for your future child, for your baby, than get vaccinated. I just really wholeheartedly ask you to get vaccinated to protect your child. There's been a study also that came out. They looked at 2,456 women who were pregnant and before 20 weeks of gestation and got the COVID vaccine. The miscarriage rate was exactly the same as unvaccinated women. And another study looked at 105,000 pregnancies over the last several months while Delta was here, while the vaccines were available, and they saw no difference in the miscarriage rate between those who got vaccinated and those who did not get vaccinated in 105,000 pregnancies. So it is absolutely critical. It's a myth. It has been studied. that, vaccines do not cause miscarriages.
This is one of the things where, 6 months ago, we couldn't speak with the level of knowledge that we can today to say that that now it is clear based on the science and the evidence that if you're a pregnant woman, you should be vaccinated. It's the best thing that you can do is to be vaccinated against COVID-19.
Thank you.
There's a question I just saw popped in. It said, is 64 patients hospitalized considered a high number? Yes, that's a high number. And the burden that 64 patients in our hospital places on our healthcare system for those patients that need isolation level care and all the things that they need to help them battle COVID-19, it is a high burden and puts a high stress level on our healthcare system. It's why we wanted to speak again to the community to talk about that, to raise awareness of how prevalent coronavirus is again in our community. And we all wish we weren't here today where we are, but this is the reality of what we're seeing. And we want to make the community more aware of that so that you can take steps to help lower that. And some of those things that we can do are things we've talked about before about, distancing, limiting time indoors, being in well-ventilated areas, other sorts of things. But the biggest thing you can do is get vaccinated if you have not been vaccinated. It lowers the overall prevalence and ability for the virus to spread in our community. The more people that are vaccinated and the less places there are for the virus to take hold, the less we'll have future mutations that we have to deal with. And others are talking about new ones that might be popping up. And I don't know what that portends for our future. We'll see. There are some worrisome things that people are seeing in some new variants and mutations that are occurring. But one way we can help prevent those mutations is not giving the virus the petri dish that it needs to be able to mutate and spread and lower the overall prevalence. So if everybody was vaccinated, the virus wouldn't have a place to make those new mutations and those new variants that become so worrisome for us.
Yeah, and I think the answer to the question, I forgot, should you get the booster vaccine if you're pregnant, if you've had the first 2 vaccines? We don't know. I spoke a lot of data that we do know, and I'm happy to give that answer. We don't know. So I can't answer that question as far as boosters in pregnancy.
But you should get vaccinated with 2 doses of
2 doses.
Either the Pfizer or Moderna vaccine. That is clear. The booster, that we don't know.
We don't know.
But
I did want to elaborate on Mike's comment around the mutations. And sometimes I get questions around how do the mutations come about and how does vaccination actually reduce the risk of mutations? What I'd like to, and generally the analogy I'd like to give is your armed forces can be already ready to go, deployed in another nation and ready to fight. And that's vaccination. Your armed forces are ready to go. And so the chances that that enemy, the virus, gets an opportunity to mutate is less because there's a very quick response to that virus. Unlike what happens in an unvaccinated individual who has to rev up, they are starting from the bare bones. They're starting and they're manufacturing. They are recruiting their soldiers. And so that virus in that time, that lag time is getting an opportunity to replicate. Every time that virus replicates, it gets a chance to make a mistake. And there is a possibility that that mistake could somehow benefit the virus and make it stronger. And so this is why it's immensely important to vaccinate. There's so many reasons. I mean, we're protecting our community at large and preventing the opportunities of future mutations to come about.
Thank you. And we mentioned masks briefly. Can we talk about mask efficacy? That's a question that came up, but if you want to cover something, Dr. McDermott, before we get to masks, that's.
Well, I'll mention something real quick and then others could jump in about masks. There has been more data that is coming out about the effectiveness of masks, and masks are very effective in reducing the spread of respiratory viruses. That's for sure. They are not perfect. Everybody says that, oh, there's the mask. No, but they are very effective at reducing the overall spread of respiratory viruses, including COVID-19. And then there's talk about the quality of masks, and there are different quality and filtration N95 masks that our care team wears when they go into the rooms of patients with COVID-19, provide a very high level of protection. The virus can't pass through that level of filtration. So there are different levels of quality and filtration of the mask. I would just encourage everybody to wear the highest quality mask that they feel comfortable wearing.
Thank you. And let's talk a little treatment. We had a question about what types of treatment do we offer. One of them that was listed there was monoclonal antibodies. Another is ivermectin, and another is the hydroxychloroquine. I don't think I pronounced that correctly, but if we could address that, the treatment options and what options people do have if they have COVID-19.
I'm very proud of our monoclonal antibody program. We were one of the first to get one program started in the state, and we continue to be one of the largest programs in the state. We are giving treatment to now well over 100 individuals a week with monoclonal antibody. I heard we gave 36 doses on Labor Day, on a holiday. So many people are benefiting. We have probably with our treatments prevented dozens upon dozens of hospitalizations and deaths throughout the pandemic. People who are at high risk, who are exposed, and the earlier in your COVID diagnosis, the better, as far as getting a better effect from the monoclonal antibody, because these are antibodies, like Dr. Taylor said, this is the Army. We're giving you those soldiers, if you don't have them, to fight early before the virus can make you very ill. This is not a substitution to vaccination.
It's not.
It is not a sub. This is an IV infusion. It's time, resource intensive. We're happy to give it if you need it, but this is not a substitution for vaccination. I really implore everybody to get vaccinated. This is an expensive medication. This is higher risk than a vaccine. There's no question. But if you do get COVID, we are here for you to administer it. There's a lot of other things going around, ivermectin, hydroxychloroquine. There is no evidence, and these have been studied now, multiple trials, no evidence that these drugs work. It is really another tragedy that we hear people going to horse and farm places getting ivermectin meant for animals because they can't get it a script. That's just really strongly recommend against that. Get vaccinated, see your physician if you really need treatment, but none of those things are effective and they could be dangerous.
I mean, the skepticism, again, I just want to address it, like, as you hear this, like people saying like, oh, the doctors don't want ivermectin to be effective. It's like, hey, I can guarantee you every single physician.
We do. We want anything to be effective. If it's not, it's not.
If they said lemon juice cures it and it survived the scrutiny of medicine and the studies to evaluate whether it works or not, we'd be thrilled. Like, trust me, nobody cares what the answer is as long as science and medicine, it survives the scrutiny to show that it's beneficial, right? That's it. Nobody holds a bias against any individual medication or anything like that. Like, we want a cure. We want things that will make people better. It's just, we don't just take anecdote or one person saying it. It needs to survive science and study to show that it actually is effective. And these other medications, ivermectin, hydroxychloroquine, have not. They have actually been studied and they have not proven to be effective. And so nobody's bearing a grudge against them. It's just they haven't shown to be effective actually when put in studies and put through science and medicine. Unfortunately, I wish they were, but they're not.
Thank you. We had a couple of questions about testing. There's a lot of different testing options. There's rapid tests, PCR tests, antigen tests, home tests, kits that you can buy at the pharmacy that you can do at home. How can our viewers trust the results of the test? If somebody goes and gets a rapid test, it comes back positive, then they get a PCR and the test is negative, what do we do with that information?
If you had positive symptoms and you had a positive test, I think you're positive. And even if one of them said negative later, and you might think it's a higher quality test, it's like, well, there's false negatives too. If you had symptoms of COVID and one of the tests showed you're positive, you'd likely have COVID. I would say that in that scenario. There are differences in how these tests are performed and their accuracy and other sorts of things. But almost every test available in our country is in some way regulated as a medical test by the FDA and has survived some level of scrutiny to be available and to be purchasable or used in one of our care environments. And there are some differences between the tests, but most of the tests I would call them as being fairly accurate with some level of inaccuracy. Some of that has to do with the testing, the swab. Did it catch the virus when it was in there and enough of it to be amplified and caught by the test? there is just variability in testing procedure as well. So they are not absolutely perfect, but they are pretty good. If you have symptoms and you have a positive test, you probably have COVID.
Yeah, one common scenario that I see mentioned, antigen tests are sometimes being done for surveillance. You feel well, but in order to go on a trip, you need a antigen test to say you're positive or negative. And you have no symptoms and it turns up positive. Sometimes people will get a PCR test, which is a little more involved and accurate, and that could be negative. So that's a scenario where there could be a false positive. But if you have symptoms and you, as Mike said, and you get a positive test, you're positive. You don't need any further testing. No further testing is warranted.
Thank you. And if somebody had their COVID-19 vaccinations, double dose or single dose Johnson & Johnson, and had since had COVID and received monoclonal antibodies, will they be ineligible for a booster? Do we know yet?
Yeah, the monoclonal antibody, those antibodies you get stay in your system for about 90 days. So you do not need vaccination for 90 days following a monoclonal antibody. As far as recommendations for boosters, again, we'll just have to see as that data comes out for those individuals. But I would suggest that's a person that probably has pretty robust immune system in that they've had vaccines, they've had COVID, they've had monoclonal antibody. I think they're pretty protected at this point.
There's a couple of shout outs. There's a couple of shout outs from patients who are very grateful for receiving monoclonal antibodies in our clinic and talking about saving lives and everything. And I appreciate all those great comments, but I would ask each one of those grateful individuals, right? I would ask them to please talk to some of their friends who maybe haven't been vaccinated to help them prevent from even catching COVID, and encourage them to go get vaccinated and protect themselves, because that is the best thing that they can do, the best health decision that they can make. Don't wait till you get COVID and have to go through this higher risk monoclonal antibody infusion to hopefully get you on the right course to being better. Protect yourself with the vaccine. So if you are grateful for having received those antibodies, and I'm glad you're on the right track and we were able to help make you better, but I would just ask you, well, if you're so grateful, please encourage your friends, families, and others out there, go get vaccinated so they don't have to go through that.
Please help us.
That's right. Thank you. And, we have a few folks asking just about the younger group, that 12 to 15-year-old group. Originally, everything was approved for 16 and up. And now the 12 to 15s are in that eligible range for vaccination. There's still some folks who might be hesitant about getting their child vaccinated, or others. We have one on here who said, my pharmacist said, I'm not getting my 13-year-old vaccinated because there's cardiac risk in children. Can we talk about that 12 to 15? And then also, what can we do to protect the under 12?
I can talk about it very personally because I have 12-year-old twins, and I was a little skeptical about vaccination in that age group initially. I reviewed the data extensively, being their dad, and with the Delta variant, both of my children received the second dose last week. These are safe vaccines in that age group. There is a small risk of myocarditis in young boys and young men. So that is legitimate, but it is far less than the risk from COVID, and COVID causes myocarditis. So with my children going back to school, I felt very strongly about the safety of the vaccine in in that age group and the importance of getting my children vaccinated. So in that 12 to 16 age group, I can say, personally, I think it's safe and I highly recommend it. And we need to vaccinate our kids so they can go back to school in person, get back to their lives. It is critical. It is heartbreaking to me when I see schools here closing down. I know the school districts are working so hard, but this is now the third school year that children have been affected. This has been since spring of 2020. This is the third school year. It is affecting our children psychologically, is affecting them emotionally, it's affecting their education. This is very important to protect our kids. Teachers need to get vaccinated. School officials need to get vaccinated, protect the children who cannot be vaccinated so they can be in school in person. And I know our school districts are working so hard to make that happen. They're in a very difficult situation, but we need to normalize life for our children.
And we are getting some questions about long-term COVID. There's a lot in the media about having extended out issues as a result of having a COVID-19 positive response. Can we talk a little about long-term COVID and what does that look like in patients and what can they do?
About 10% of patients who've had COVID are now having long-term symptoms. Some of those is just loss of taste or smell, which are not great things to have long-term, but chronic fatigue, headaches, mental cloudiness and fogginess. People are on disability now long-term. So it is significant. That's a large number of people. Millions of people have had COVID, and 10% is a large number of people in the United States who are now suffering with long-term symptoms. So that's just one more reason to get vaccinated. People say to me, I had somebody had a discussion today, well, how do I know this vaccine won't do something to me 5 or 10 years down the road? That's highly, highly unlikely with a vaccine. I can't say for 1,000%, positivity that couldn't happen, but it is highly unlikely. We do know your risk of getting COVID today is very high, and your risk of long-term COVID is 10%. So that is very significant. There is no comparison in the risk-benefit ratio.
Yeah, that whole idea of like long-term effects or whatever, it is a small, very specially designed sugar molecule. It's what it is. It's ribose. It's based on a sugar backbone, right? Specially designed sugar molecule that put in, that gives a message to your body, and then it's digested just like other sugar molecules in your body are, right? So it's the same thing like when you eat a Big Mac in the special sauce, or you're thinking about the long-term effects of that special sauce. No, it goes through your body, it's digested, and then you move through like to a new day, a new week, a new month, and a new year. And so, the safety profile of this vaccine has been established now over 5 billion doses administered in the world. Really, it's extraordinary how safe and effective these vaccines are at this point in time. So,
thank
we
you.
Always have to.
Sorry, Dr. Kill.
When we talk about safety and efficacy, I always think about the medications that we take all the time. Ibuprofen and Tylenol. And we never second guess to go in the cabinet and pop, 600 of ibuprofen or whatever the case may be. But all of those medications come with their own safety concerns. But we do a risk-benefit ratio, right? So we say, listen, this headache is really kicking my tail, so I'm going to take this ibuprofen. And it is very confusing for me as a healthcare provider to see that we're doing this risk-benefit ratio and somehow vaccination and protection isn't measuring up. We do the same thing when patients come in for chemotherapy, right? And they are now have cancer for some unfortunate reason, and we're making the decision on, do I proceed with this cancer or do I take this medication that has long-term and potential harmful side effects? And so there are these risk-benefit ratios, and in a multitude of other situations, we proceed. And to Mike's point earlier, we trust the science and we trust the data behind it. So it's really confusing at times and heartbreaking to see that we're not trusting, that the community at times is not trusting us now.
Rarely is the signal so clear as it is here with this virus of the risk-benefit ratio, right? Extraordinarily safe and effective vaccines, extraordinary benefit. Right? It's really remarkable. Rarely is it tilted so far in this direction. We make many other choices, Sheena, like you're saying, that are much closer and need to be weighed. This one is, in essence, what many people would call a no-brainer, right? It really, really is. And rarely do they come as clear as with risk-benefit ratio as this coronavirus vaccine.
And I think we have one final question coming in. We're getting close to the end of our time. And this person is specifically asking about the incentives or incentivizing or requiring vaccination. What can we tell people to help them trust the medical community outside of any kind of requirement or incentive? Well, certainly people can share their experience, but what can we advise people to say?
Some of those incentives that you've seen other states have done to get people vaccinated were done all in the interest of public health, right? Doing whatever it takes to get people vaccinated so that we can ensure society and civilization is safer, right? And public health is improved. But I'll talk a little bit about vaccine requirements and people talking about medical freedom. And it's like, well, what is important in civilization in our society, take Mary Washington Healthcare. We have a requirement that all of our associates who are part of our team are going to be vaccinated against the coronavirus. And there were some questions saying, it's like, well, we were heroes before, how come we're not heroes today? Every member of our team is a hero, and they're still a hero, right? But we as healthcare providers have responsibilities to our community. People come to us for care when they are in circumstances where they can't wholly protect themselves, right? And so we have to protect them. It's one of our sacred duties we have to protect our patients. And so now, if a patient comes to us who's immunocompromised, some of these patients that we're caring for in our hospital now, those vaccinated patients that are here in the hospital, they're immunocompromised. They received the vaccine, but their body couldn't make the antibodies to help them fight the coronavirus. And when they got exposed, they got sick, and now they're here in the hospital. Those are patients that we can protect. Those patients, many of those patients, unfortunately, have to come to our hospital to be hospitalized or to our care sites, doctors' offices, to get cared for when they're immunocompromised. So we have to do everything we can to protect them and keep them safe. One of the things that we can do to make them safer is to all be vaccinated. So we have a lower chance of harboring the coronavirus that might make them sick. Also, we all work in care environments where we're around one another, right? And so if we're all vaccinated, we create a safer workplace for every team member and teammate that's part of our Mary Washington Healthcare team. So I'm proud to talk about our vaccine requirement. We do it all under the auspices of safety. And I would say to our community, there's no safer place that you can receive care than Mary Washington Healthcare. We are committed to your safety and to the safety of our care team, not just with the coronavirus, but when every action that we do is centered around patient safety and high reliability is how we frame it as an organization. And so I want to talk to our community about that. And that's why our decision to require the vaccine, it is centered in our commitment to be a high reliability organization for our community and to make sure safety comes first.
When you talk about that, Mike, that's our responsibility. We all took an oath. I have a license that says we will keep people safe. So that's what we're here for. That's what the community trusts. They come to us when they need us. And now what we're saying to the community is we're going to keep our facilities, our places safe. So this can be the place that you can trust and you can come, but we need your help.
Thank you. And thank you to all of our panelists. We're going to go ahead and close up, but I'd like to invite any of our panelists for anything that you'd like to add before we complete this evening.
I'll thank everybody in the community for taking time out of their evening to tune into these town halls. I know we're getting a lot of great comments from folks thanking us for doing them, and we are happy when we have times like this to get out in front of the community. We want to tell them, I think we've been extraordinarily transparent throughout the pandemic. We are combating misinformation, and we want to provide, if we can provide a trusted source of information and truth about what's happening here in the Fredericksburg region, we want to be able to do that. So just a thank you to everybody in the community for your interest. I ask everybody to do their part in helping to spread the word. And I guess, the theme for today is spread that word, is really encourage everybody out there who has not yet been vaccinated to please take that step to protect themselves, our community, our civilization, and do what we need to do to get vaccinated to help lower the prevalence of coronavirus. It's our way out of this pandemic.
Yes, and we appreciate the tough questions. Somebody thanked us for answering the tough questions. We want to answer those tough questions to be able to separate fact from fiction. So thank you to all of our viewers and our panelists for tackling the tough questions tonight. Thank you to everyone for tuning in to our community town hall. Just a reminder of our HealthLink nurses, if you're having symptoms and you just don't know where to seek care, our Mary Washington Healthcare Triage line, which is free service, is available daily from 6 a.m. to midnight. Please call. Our nurses will happily guide you with where you need to seek care by calling 741-1000. I want to also remind people where they can go to get a vaccine. Vaccinate.virginia.gov is a website where you can go and search where there's availability of vaccine. You can do it by location or the type of vaccine that you're seeking and find a place. A lot of locations even have walk-in same-day appointments for your vaccine. The local health department is also offering free COVID testing. There's some locations, they spread out throughout the rest of this year, September and October dates. So on your screen are a few dates, but go ahead and register on the Rappahannock Department of Health website if you feel that you need a COVID test. Of course, if you've missed some of tonight's town hall or want to rewatch or share with friends, you can watch the recording on our Facebook page or the Mary Washington Healthcare YouTube channel. Share the recording with your friends and family. It might be a good way to have that vaccine conversation that we were talking about today. So please stay safe and healthy. Thank you for joining us and have a good night.